Hello, everybody. It's my great pleasure to be here on behalf of all my co-authors presenting our research on social support and connective affordances. This particular study was based on a dataset we collected in early 2020. During that period of time, Wuhan was the first city in the world locked down because of an outbreak. As a result, social media such as Chinese Weibo and WeChat served an important communication channel for people to gather together, exchanging information, coordinating resources, and providing help. We focus on a particular emerging new media platform that is called a Super Topics platform, provided by the Chinese Weibo, a microblog. Here's our research review. In the past, there is very rich research on social support and crises. Researchers have classified social support into three general categories, including cognitive, informational, and emotional support. Social media has also been found to be tightly related to social support due to its connective nature and providing an opportunity for people to collectively cope with a crisis. There is a very interesting line of research in recent years, which is paralinguistic digital affordances. Specifically, this line of research has shown that various affordances provided by social media can make a significant impact on people's decisions, interactions, and communications. For instance, researchers have found that the @ symbol provided by social media, such as a microblog or Weibo, does help provide a specific social support, which is diffusional support. Here are three of our research questions. First, we look at what kind of network features, message features, and patient features might influence the social support manifested in the paralinguistic affordances, including the number of sharing, endorsing, and commenting. The second research question focuses on the typology of social support. We want to analyze what kind of social support, emotional, informational, or diffusional, that is manifested in support seekers' posts on the social media platform. The third question looks at how those message features, patient features, and the features of those messages correspond to the responses those early patients had received from other users. The data collection was was finished in about a month, and overall we collected more than 800 patients' posts, along with the comments from about 300 users, and those led to a total of 81,000 comments. Here are some measures we used in our project. The network features primarily included the number of tweets, the number of followers, and the number of followees. We also analyzed the posts posted by those early patients, including information richness, for instance, whether a post is just presented in plain text, or a post also includes pictures or videos. The second measure of message feature is about emotional intensity. We look at how strong emotion is in a specific post posted by an early patient. Emotional valence, including anxiety, gratitude, and sadness. And this was measured by the dictionary LIWC. Patient features include whether a patient has any symptoms of a chronic illness, or reported any death of a family member, and the number of infected care family members. Our results showed that the number of patients' followers, microblog followers, did strongly predict the total amount of retweeting, commenting, endorsing of their support-seeking messages. And the more emotionally expressive the support-seeking message is, the more likely that message is to be shared, endorsed, and commented. And if a patient if a patient in his message reported suffering some sort of chronic illness such as diabetes, then other message viewers were more likely to retweet, comment, and share that message. Overall, 3 types of social support were identified in those posts and responses. Specifically, they include emotional support, informational support, and diffusional support. And the most prevalent type of support is emotional support and diffusional support, such as encouragement and sharing the information, a patient's messages through by directing at other individual accounts. And we also found that whether a patient reported the death of family members and the number of infected family members predicted the provision of sympathy from other users. Information richness of the posts will also turn out to be a significant predictor of informational support and diffusional support. To conclude our study, we found that support seekers, network features, message features, and the portrayal of a patient together influenced the amount of support, social support that they received from others. Weibo users primarily provided 3 forms of social support, including emotional, informational, and diffusional. The richer information a person disclosed, the more informational and diffusional support would be provided. Another interesting finding is that the most frequently directed accounts for spreading a patient's support-seeking message are those mainstream media accounts, showing that mainstream media accounts are still strongly trusted, and people believe that those users still believe that those accounts are more likely to be to help messages to spread out. Thank you.